Shalom, giving all praises to Yahweh, Bahashem, Yahweh Shai, Bahashem, Rakah Kodash, for giving us the understanding of the Holy Bible through their men, beginning with the apostles and the bishops of Great Millstone. These are the men that are worthy of double honors in the time that we're living in, which we're living at the very end of the world, in the sense of the Greek word eon, which means an age, a time period, a rulership, and that's pursuant to Matthew 24, verse 3, concerning the return of our Lord and Savior, Yahweh Shai, and the end of Esau's world, as is written in 2 Ezra 6 and verse 9. So with that being said, Yahweh WATCHMEN Shai Bahashem, Rakah Kodash Brakatham, to the 144,000 servants as well as the remaining elect of Israel. Now I want to play you this video here. It's in regards to this meeting that Donald Trump just had with his cabinet, his administration. As you can see here in the description, it says, President Donald Trump delivered remarks Wednesday, making health technology great again. During an event at the White House, he was joined alongside Health and Human Services Secretary Robert F. Kennedy Jr., Crypto Caesar, David Sachs, and others. Right, the others include Dr. Oz, which is a part of Donald Trump's cabinet. It says Trump noted that new health technology will save lives and that doctors and patients will always remain in control. So basically this video ties in with videos that we've done in the past concerning the mark of the beast, which is the implantable microchip. Okay, and what I'm going to do, Lord willing, is put the videos that I've done on this topic as it pertains to Dr. Oz and Donald Trump and the O.T.B. I'm going to put those videos in the box below so you can check them out in your own time. But basically they're pushing digital technology in regards to healthcare and whatnot, and what this is leading to, or what this is going to lead to, is the fulfillment of what the Apostle John saw in his vision recorded in Revelation 13 and 16. And he causeth all, both small and great, rich and poor, free and bond, to receive a mark in their right hand or in their foreheads, and that no man might buy or sell save he that had the mark, or the name of the beast, or the number of his name. Again, the mark is referring to the implantable microchip. Okay, and that's what's going to be at the helm of digital healthcare in the very near future. But yeah, without further ado, let's check it out.
I'm also grateful to be joined by numerous congressmen. I'm not going to name you if you don't mind. I'll probably never get their vote again, but it's too many. Thank you very much for being here. The Congress has been great. Senators have been great, and the congressmen and women have been great. We just passed the most important, I think, look, I can't say most important, but certainly one of the most, but the most consequential and the largest bill in the history of Congress. And I call it the great, big, beautiful bill. We call it different names, but it all means the same thing. For decades, America's healthcare networks have been overdue for a high-tech upgrade, and that's what we're doing. The existing systems are often slow, costly, and incompatible with one another. But with today's announcement, we take a major step to bring healthcare into the digital age, something that is absolutely vital. You got to do it. Moving from clipboards and fax machines into a new era of convenience, profitability, and speed, and frankly, better health for people.
So the key words was speed and convenience. Okay, and that's how they're going to push, this implantable microchip. They're going to push it as a thing of convenience and speed. Okay, that's how they're going to deceive you Americans into getting down with their beast system in terms of actually taking the mark. All right, so keep that in mind. Speed and convenience. You know, as it's written in 2 Corinthians 2 and verse 11, lest Satan should get an advantage of us, for we are not ignorant of his devices. Okay, and that's referring to those of us that have this truth, you know, that understand what's going on prophetically, you know, concerning the wicked elite, bringing about their new world order, which, by the way, you can read on the back of the $1 bill in Latin, Novus Ordo Seclorum. Okay, that's Latin for New World Order. And pretty much, you know, they're plotting right now to fully establish that New World Order. And they want to enslave the masses of people, you know, via the chip. Okay, by any means necessary. That's their agenda. That's their goal. Right? So let's continue on.
Under the leadership of Administrator Oz, we're officially launching the CMS Digital Health Tech ecosystem to give healthcare providers, insurers, and software companies the tools they need to empower Americans with a 21st century experience on health. The key breakthrough we've made is getting many of the biggest names in the healthcare and technology to agree to industry-wide standards for electronic medical records. All of those great companies that you just heard have gotten together with this group of very brilliant people. I don't know who's more brilliant, them or them. I don't know. Could be them. I hate to tell you. It could very well be them. But I don't know. I'm going to take my team. But the key breakthrough we've made is getting many of the biggest names in healthcare and technology to agree to that those standards of electronic medical records that we talk about and you've heard about for so many years, and now it's happening. This will allow patients to easily transmit information from one doctor to another, even if they're different networks and using different record-keeping systems. No matter what system they use, they're all transferable. The new standards will also make it simple for patients to access their own personal health records. I don't want to see mine, please. I don't want to see. I don't know about you. They have all sorts of things, sir. They can tell you exactly what your problem is going to be in 6 years. We can do it. You know, they have all these different things. I don't know if they work or not, but I didn't want to hear it. I didn't want to hear it. If they got a problem, I don't want to know about it right now. But it is amazing what they're doing. I don't know. Does it actually work? Can they do that? All right. Well, then I'm glad I said I don't want to know. But thanks to this announcement, healthcare providers across the country will also finally be able to kill the clipboard. It's an expression that's used, capital, with a capital C, kill the clipboard. Instead of filling out the same tedious paperwork at every medical appointment, patients will simply be able to grant their doctors access to their records at the push of a button. Just a button and you're all set, and all the information the doctor needs will be immediately transmitted. The system will be entirely opt-in, and there will be no centralized government-run database, which everyone is always concerned about. I'm less concerned than anybody. I say whatever it is. But people are very, very concerned about the personal records. They want to keep them very quiet, and that's their choice. I think it's a great thing because it'll be absolutely quiet. Instead, doctors and patients will always remain in control. The benefits to millions of Americans will be enormous. We will save time, we'll save money, and most importantly, we'll save lives. It's just going to make people live longer and be a lot healthier. I think that's really what you're looking to do. And now I'd like to ask Secretary Kennedy to say a few words, followed by David Sachs, Dr. Oz, and Amy Gleason. Thank you very much, everybody.
Thank you very much, Mr. President. And I just want to begin by making a comment that is irrelevant to what we're gathered here today to talk about. But I've been coming to this building for 65 years, and I have to say that it's never looked better. I I've spent some time in the Oval Office, which really it's been transformed. And I was looking at a picture of the Oval Office the other day when I was...
Which, by the way, Robert F. Kennedy Jr., he's the one that's at the helm of pushing wearables, which the ultimate wearable, again, is going to come in the form of the chip, right? The micro C hip, which is the mark. And it's only a matter of time where they throw out wearables, you know, where they throw out having your smartphone and just replace, you know, your wearable or your smartphone with the chip, which the chip is going to work hand in hand with your smartphone and whatever RFID or NFC readers that they have. All right, but the point that I'm making is that, you know, the chip is the ultimate wearable, in which right now you have Robert F. Kennedy Jr. pushing wearables. Okay. You know what I'm going to do? Let's skip to what Dr. Oz has to say here.
Dave, thank you. And now, Dr. Oz. Mr. President, today we are making American health technology remarkably great again. We've always been into leadership. David's right. I called him early on after the president offered me the position, him as well. And we began brainstorming on this. Secretary Kennedy from day one appreciated the crisis that we're in and how we needed to address it. So today is a remarkably important day, one that you will remember, I believe, for years to come for three reasons. Yes, it is the 60th birthday of Medicare and Medicaid. The first patient, by the way, was Harry S. Truman. Although Lyndon Johnson signed the legislation 60 years ago today, not far from here. It is not just the ability to bring 60 of the top incumbents and insurgents in health technology, hospital systems, insurance companies, electronic medical record companies, AI companies, the big players. You're all here, and we appreciate that very much. But Mr. President, you used the power to convene. That's fundamentally what I think the president has been able to offer us. And Secretary Kennedy offered us as a group some examples, but there are more to come. And I want to touch on some of these. But first, I've got to do what doctors often have to do, which is to tell you the truth, even if you don't want to hear it. So here goes. These beautiful programs, which are the backbone of the social network, the social support system of this country, the safety net, they're flailing. They're flailing for a bunch of reasons. Medicaid is a unique entity. It has deviated from its original purpose by drift and by design. The One Big Beautiful Bill, the OB3 law, was elegant for that very reason. And President, I don't know if you remember this, I can share this, but he called me once and he was upset at me because I was going too strident at something. And he said, this is about fraud, waste, and abuse. That's what we're interested in doing. And that's exactly what the One Big Beautiful Bill accomplished. And it especially did it to save Medicaid by putting $200 billion more into it and allocating funds very specifically to use to support rural America. And primarily, some of that money will be used to support digital infrastructure, which is terribly lacking in many parts of the country. The money that's sent from Washington doesn't get to rural America. About 7% of Medicaid dollars get to rural hospitals. We now have an ability to infuse funds through this $50 billion Rural Health Transformation Fund into that system. The gathering today is another example of how we can actually jumpstart that and accelerate it. The other reality is COVID broke the system. It didn't for many reasons. Medicaid expenses went up 50% in 5 years. Medicare, the trust fund that we met at actually Treasury with Secretary Besson and Secretary Kennedy as trustees, it goes bankrupt in 2033. And that is actually a conservative estimate. It could go bankrupt as early as 2029. Thankfully, due to the economy, that's not going to happen. But we don't want to have to take that risk. And there's some fundamental changes we need to make accordingly. Now, there's one other big reality about making the system more efficient, which is why what everyone here is talking about is so critical. And let's just pick an average American born in 1964. That average American born in 64 will retire this year at age 61. If just that one group of people born in 64 could work 3 years longer because they're healthy, because they feel like they want to do it, because they feel vital and vigorous and they're flourishing, just that 1 year working longer is $1 trillion to the U.S. GDP, and is $300 billion of tax revenue to pay for a lot of the problems that people are concerned about. So it's not just keeping people out of the hospital, getting them to thrive and flourish that makes what we're doing so critical today. I think there are a lot of realities to how healthcare has gone. Unfortunately, the system is frozen, and it has been for many reasons, despite efforts in the first administration. It's frozen in time, so it cannot address the quality lags that exist. While Netflix and Airbnb and Uber drivers are racing ahead, making arrangements, identifying the problems that are challenging us in healthcare have become incredibly difficult. You can't make appointments. The average Americans are tired. They're tired of waiting for a doctor's appointment. They're tired of waiting for the surprise of what your hospital bill is going to offer. That's being addressed by one of the president's executive orders. They're tired of waiting for access to their medical records. You own your medical records. They're yours. Why you can't have access to them is a stunning reality in modern day America. They're also tired of waiting for Washington to take action. And this president early on emphatically stated that wasn't going to happen anymore. And today we made that vision into a reality. And there's a fine line between vision and hallucination. What you did today was show it's a vision, because you share it with us and we're moving ahead on it. And that's what today's commitments essentially are reflecting. And they are pledges, they're not laws. They're nimble and they're fast and they're quick, because the president understands that each of you in your own way understand these needs. And Secretary Kennedy spoke beautifully about the reality of what happens when you actually have electronic records, because what he said is happening in Indonesia, we'll have here. Within a year on your device, and 91% of Medicaid patients have smartphones. On this device, you'll get insights based on your records if you want. You don't have to take this, but if you desire, Amy Gleason is one of the smartest people I've ever worked with, has built a mechanism to be able to get you that information in a way with all of these partners helping, so that you can get nudged to pay attention to what you're eating and avoid processed foods. Secretary Kennedy smartly and wisely highlighted is so dangerous to our well-being. All of this, by the way, is that will be at the fingertips. In addition, advice about which doctor to see, when to go see them, nudges, reminding you why I didn't do certain things. If you're a doctor like me, it's a very different story. It's to help you navigate the system better. It's giving you advice, decision support, which is becoming increasingly important as medicine gets more difficult. But I'll tell you the best thing of all, how many of you have been with your doctor telling them something heartfelt, very emotional, and they're looking to the side, typing into their computer, right? It's common. Put your hands up. I just want to see it. Yeah, most everybody. And that's unfortunate, because the whole sacrament, the whole covenant of being with the doctor is having them look you in the eyes and realize you're there for each other. That process is going to go away. We will, within the workflow of doctors, be able, with your help, allow physicians to take care of patients, gather the information while they're doing it, and will destroy the upcoding that has hurt Medicare Advantage and other programs in a similar fashion. The IT infrastructure that's going to change promises to improve a lot of things. We're going to cut fraud, waste, and abuse. Mr. President, we announced with the DOJ 2 weeks ago a $15 billion bust. $15 billion is a multinational criminal syndicate based primarily, we believe, in the Soviet Union, in Russia. And what they did was hack using beneficiary numbers into the system. We'll be able to stop that because of a system that Amy's put together, and the wonderful work of Amy Brandt, who has a fraud war room using this kind of technology, because we'll know who you are and who your doctor is. We can block this. We're going to have remarkable advances in how consumers can use their own records. We'll have beneficiaries be able to get MAHA advice and prevention tips, and even be able to nudge them and reward them perhaps for that. And all this comes back to one fundamental issue, Mr. President, which is leadership. I think 60 people, the biggest, the best, the willing, came forward because of your leadership, because you weren't going to take no for an answer, and they know it. We are building a robust and safe, I emphasize that, safe system. It's going to protect the data better than we could have imagined. We're going to be able to accomplish goals that all of us wished from day one that they would be in place. These pledges are now confirmed. They're signed in public. You have therefore empowered Americans to own their property, which is their medical records. Let me introduce Amy Gleason. She is acting director of DOGE, U.S. Digital Service as well, and was actually the brilliant woman who pulled together the pieces of this puzzle with so many members of the audience. Amy Gleason.
So again, you know, what we're looking at here is like a 40-minute long video. You know, this is like a 40-minute long conference that they had earlier today. So I'm not going to play this whole video. You know, it's going to be quite long to upload. and record. But you know, what you can do is check it out in your own time. You know, we understand the agenda that is being pushed here, all right? And that agenda is to bring about their new world order, okay? And the elite of Esau, Edom, you know, at the helm of their new world order, they pretty much want everyone chipped, okay, by any means necessary. So what we can expect is some type of major event, a black swan event, if you want to call it that, that's gonna transform society as we know it, okay? And things are gonna go fully digital, meaning cash is gonna go fully digital, because whatever that event is going to completely cripple the economy as we know it, you know, which is going to force digital currency. And we understand that the economy and finances, money, you know, that plays a major role concerning the O.T.B, again, pursuant to Revelation 13 and 16, as it's written, and that no man might buy or sell save he that had the mark or the name of the beast or the number of his name. All right, so again, pursuant to Revelation 13 verses 16 to 17, we understand that the O.T.B is going to revolve around the economy, transactions, business, okay, cash, if you will. But it's also going to revolve around healthcare. All right, hence, you know, this conference that they're having right now, because healthcare is going to be transformed too. All right, you know, healthcare as you know it is going to go fully digital, and you know, very soon, in the very near future, expect for them to start pushing this chip, you know, in terms of it being a convenient way to store your medical records, in which the chip can do that. And that's when you have to go into the word mark, right? In that particular prophecy, you know, when you go into that word mark in the Greek, you find the Greek word charagma, which is defined as an incision, okay? And when you go further into that word, when you go deeper into that Greek word charagma, you'll find the Greek word charux, okay, which is defined as a palisade, which if you look up what a palisade is, it's a sharp, it's something that you would put into the ground, right? It's a sharp instrument, so to speak. And we understand that that's going to be the delivery system in the form of a needle, right? A 12 gauge needle that's going to be used to actually implant the chip in itself underneath the skin. And then when you go further into those words, charagma and charux, you'll find the Greek word grapho, okay, which grapho is defined as records, essentially, right? It's actually defined as records. So that's going into the data that's going to be stored on the chip, right? The data in terms of your money, all right, your digital ID, as in your identification, that's going to be stored on the chip. Your medical records, your driver's license, you know, your passport information, your social security, or if you're out there in the UK, your national insurance number. All of that information is going to be stored directly on the chip, okay? So, you know, this is the agenda that they're pushing, and it's only a matter of time to where, you know, what the Apostle John saw in his vision, you know, is fully fulfilled on a global level. And America is going to be at the helm of, you know, pushing the chip. And all the other countries around the world are going to follow suit, okay? the only hurdle that they need to jump right now, or the obstacle, is privacy. Okay, the privacy issue, which they're gonna, you know, overcome that one way or another. But you know, we're extremely close to this prophecy being fulfilled, man. So anyway, that's all I've got to say. I pray and hope you're edified. And again, you know, check out the videos that I've done in the past concerning this matter. All right. So until next time, I'll say shalom.